Hello, dear students. A very good evening to all of you. Good evening, everyone. Good evening. So, how are you, my all dear students? Now, the session which is most demanded as well as most effective for the GPAT 2025 is going to start. So, everyone join fast. Yes. Good evening, everyone. So, my dear students, for the whole the year, you have studied very well. You have given your level best to qualify in the GPAT exam, as well as you have prepared all the contents with the short tricks, mnemonics, chart, tables, content, modules, and so much many things. But now, the last time which is most effective to complete your journey, that is the solving the MCQs. Yes, I know you will have the so much of the doubts in your mind. At this time you are thinking, sir, whether I will qualify in the GPAT exam or not, what will be my rank, what will happen during the GPAT exam. The question in mind, okay, that's okay, but believe me, the main thing which is most important, to just control yourself for the controlling negativity, for the controlling the negative marking. Read the question carefully, because many times the question you are thinking that this question is so much hard, they that have the so much hint in their meanings, so you can easily find out the correct answer. So dear students, that's why GDC have started the 500 MCQ series for the GDC English classes, and there you are not only going to read the question but also understand the concept and clear all your doubts. So let's start today's session. So my dear students, the first question from the complete pharmacology, and the first question what we have here: which of the following receptor ligand gated pathway is incorrect? Okay, so here what we have, that is the drug, and here what we have, that is the receptor. Now find out. Read the question carefully and remember all the things what you have already gone through the different topics. Like, my dear students, confirm me whether it's there any network issue. Sakshi, this is the moment where you have to clear out. Yes, what is the most important thing? Everything is okay? Okay. So let's start. Okay. What here question firstly what we have? That insulin. Can you think insulin can bind with the G protein coupled receptor? No, sir. Actually, insulin bind with the enzymatic receptor, and under the enzymatic receptor, it mainly bind with the tyrosine kinase receptor. So that's why the first option is incorrect. You can easily incorrect it. Second, mineralocorticoid. Do you really think mineralocorticoid can bind with the enzymatic receptor? Not at all. Why? Because mineralocorticoid receptor bind with the intracellular receptor. Okay, so that's why it's also incorrect. Next, what we have, adrenaline, that is binded with the ligand gated ion channel. How it is possible? Actually, adrenaline bind with the alpha and beta receptor. Alpha 1 and alpha 2 both are the ligand GPCR receptor. Alpha 1, alpha 2, beta 1, beta 2, beta 3, these all are the G protein coupled receptor. Then also it's incorrect. Now we have the vitamin D, and during classes I have given a trick. Simply you can find out, that is the, yes, what we can say, CGMP drive, Chhattisgarh Madhya Pradesh drive. That means corticosteroid, mineralocorticoid, glucocorticoid, progestin, and vitamin D. These are the drugs which bind with the intracellular receptor. Or we can also clear it out like that, it can bind with the cytoplasmic receptor. Means Yes, it comes under the nuclear receptor, but nuclear receptor again divided into the two types, that is the cytoplasmic receptor and nuclear receptor. So this is the correct one. So what we have the correct answer? Yes, only one option is correct. Vitamin D can bind with the cytoplasmic receptor, that is the type of the nuclear receptor. Else apart all the three are incorrect because from with the insulin. What we remember? Pig cytokinin. Yes. Pig cytokinin, that means prolactin, insulin, growth hormone and cytokinin. These bind with the first one, that is called as the tyrosine kinase. Vitamin D, steroid, thyroid hormone, receptor, mineralocorticoid with the nuclear receptor, G protein, adrenergic receptor, muscarinic receptor. These bind with the G protein coupled receptor. Next question. Match the following phases of clinical trial. I can assure you, you will definitely get one question from the clinical trial. So kindly revise the topic and understand what are the different phases of clinical trial, where how many peoples are used, whether it's a healthy volunteer or we can say it's the patient, or what is the purpose of that phases of clinical trial. So phase 1, which is called as the human pharmacology and safety, where we firstly introduce the drug and it's mainly used for the, that is the tolerability. That means phase 1, first in human dose. Next, phase 0, this is carried out for the study of the pharmacokinetic parameter. So now what we have here, that is called as the microdosing studies. Phase 3, that is called as the multicentric trials, because here the heterogeneous population from the different regions are added. So phase 3 multicentric, and phase 4 after the approval of the drug. Yes, the question what we have already asked from this topic, that yes, no ethical clearance required. Here, no ethical clearance required because drug is already in the market, and when there is the drug in the market, that means yes, post-marketing surveillance. So here what we have the option, 1 for R, 2 for Q, 3 for S and 4 for P. So you can easily find out the option B. Okay, Manoj, confirm the option. It's B, not A. Here is the clinical trial. First one, human pharmacology safety. Phase 2, therapeutic exploration. And phase 3, therapeutic confirmation or therapeutic comparison. Phase 4, post-marketing surveillance. And recently in the 𝙂𝙧 2023, what was the question? The large number of patient or large number of population. So clinical trial phase 4 carried out the large number of patient being treated. So this was also the important one. While if we say the NDA, after the phase 3, we go for the new drug application, that is called as the NDA. Okay. Next question. Which of the following is called a cell death? When during the anatomy and pathophysiology, you have gone through the cell death, cell repair, different like this type of the word. Then you have found that cell death can be two types. One is called as the programmed cell death and another one is called as the non-programmed cell death. That means simply the cell death, that is called as the necrosis. So here apoptosis, which is called as the programmed cell death also. Okay, and what happens here, actually when there is the any type of the programming to kill any type of the cell, that's why it is called as the apoptosis. While another one we have, that is the necrosis. Simply we can say the cell injury. Why? Because there is the chances of the hypoxia, there is the chances of the ischemia. Like when you have studied about the myocardial infarction, at that point you can say yes, that is the type of the cell necrosis. Here lipolysis, no, that is the breakdown of the lipid. Glycogenesis, that is the formation of the glycogen from the glucose, and gluconeogenesis, formation of glucose from other than carbohydrate. So what will be the correct answer? Only A, that is the apoptosis. Apoptosis is a form of the programmed cell death that occurs in the multicellular organ. Here is the programming. Firstly, we have the chromatin condensation, then we have the membrane bleeding, then nuclear collapse. And yes. There was a question. Which of the following process during the cell death or the during the apoptosis can be reversible. So the correct answer will be the nuclear clumping, or we can say, yes, this is the nuclear clumping, not collapse, but nuclear clumping will be there. What will be the elimination rate if the clearance is 130 ml per minute and the drug concentration is 0.8 gram per ml? Find out. Can you easily think out what will be the concept will applicable here? What you have to find out? Elimination rate. You have the clearance. You have the plasma drug concentration. What you have to find out? That is the rate of elimination. So what is the actual formula? Clearance is equal to the rate of elimination divided by the plasma drug concentration. Okay. Now put all the matters. You have what you have to find out? Rate of elimination is equal to the clearance multiplied by the plasma drug concentration. What is the what is the value of the clearance? Here you have the 130 ml per minute. So 130 ml per minute multiplied by the 0.8 gram per ml. So 800, 324, 818 and 2. Yeah, means 104 gram per minute. Have you find out the answer? Sana, no. Calculate that value. It will be the 104. Yes, the process is good, but the answer will be the 104 gram per minute. Simple formula. Clearance is equal rate of elimination divided by the plasma drug concentration. Okay, here is the big question. Some of the students only think, okay, if the question is large or the bigger one, then I cannot find out the answer. But no, firstly read the question carefully. That is the most important thing. Read the following statement regarding the terms and their description. What we have? Affinity is ability of the agonist to bind to the receptor. Yes, we can say, yes, it's correct. But if there is only agonist, means ability to bind with the receptor. Agonist means affinity and maximal intrinsic activity. As we know, agonists have the maximal intrinsic activity, partial agonists have the submaximal intrinsic activity, antagonists have no intrinsic activity, while inverse agonists have the negative inverse intrinsic activity. Okay, inverse agonist means drug bind to the receptor, produce the opposite activity. Efficacy means affinity can bind to a receptor but no efficacy. What? Efficacy means affinity. What is the meaning? Not at all. So this one is incorrect. So what will be the correct answer? A. Yes, PQRR true, while S is incorrect. A option will be the correct answer. Because what is efficacy? Efficacy, ability of a drug to produce the response after binding with the receptor. Means the ability means drug bind with the receptor. Now the drug have the ability to produce the response by activating this receptor. That is called as the efficacy. So that is the another term. But here what we have? Efficacy here. Efficacy, the ability to cause a response via the receptor interaction. Next question. Match list 1 with the list 2 drug and their antidotes. Poisoning and treatment. Aspirin. Okay. During the aspirin, that is the acidic in nature, we have to carry out the urine basic form. So we can easily carry it out. Yes, there will be the sodium bicarbonate. Carbon monoxide, that will be the oxygen. Isoniazid given with the pyridoxine. Here nitrate and carbamates. Nitrate, methylene blue, and carbamates, we have the atropine. Find out the answer, very easy. A for R. Oh, okay. Before going on further, the correct answer you have find out. The correct answer will be the A. And this table is so much important because very many times the antidote asked during the exam, like acetaminophen, we can say the paracetamol antidote is the N-acetylcysteine. Aspirin, we have the sodium bicarbonate. Anticoagulant, vitamin K, and vitamin K antidote, anticoagulant. Atropine, physostigmine antidote, atropine. Arsenic, EDTA. Benzodiazepine, flumazenil. Beta blocker, glucagon. cyanide, hydroxycobalamin, or we can say the sodium thiosulfate, calcium channel blocker, calcium, carbon monoxide, we can here add oxygen also, carbamates, atropine, copper D penicillamine. Last year the question was Wilson disease. What is the Wilson disease? The copper poisoning is also called as the Wilson disease. For that D penicillamine mainly used. Ergot alkaloid, nitroproside, ethylene glycol, fomepizole, isoniazid, pyridoxine. Okay, next question. Match the following drug with their adverse effect. ACE inhibitor, dry cough. Always. Why, sir? Because ACE inhibitor, they inhibit the ACE enzyme that is also responsible for the metabolism of bradykinin. But once we inhibit the ACE enzyme, then there will be the no metabolism of bradykinin. So bradykinin concentration increases in our body and mainly in the lungs, and they induces the dry cough. Isoniazid, peripheral neuritis. Penicillin G, 𝙬𝙎 eczema reaction, and morphine, it's constipation. So 1 for Q, okay, 2 for S. Yes, correct answer will be the B answer, because these are the identical, or we can say the some important parameters like isoniazid, very important adverse effect. So that's why we remembered for the isoniazid we write it as the INH because its full name is isonicotinic acid hydrazide. It causes the insanity, means psychosis. It causes the neurotoxicity, means neuritis. It causes the hepatotoxicity, and for this neurotoxicity we always provide isoniazid with the vitamin B6 to control this neurotoxicity or neuritis. Here are the identical drug and they are the unique, or we can say the important adverse effect like chloramphenicol, gray baby syndrome, aspirin, Rage syndrome. We have the nitrofurantoin, that is the Loferman syndrome. Then we have the morphine, causes the pinpoint pupil miosis as well as the constipation. Similarly, ACE inhibitor, dry cough, ampicillin, we can say the hypersensitivity. All the penicillin derivative mainly have the hypersensitivity reaction. Clozapine, agranulocytosis, metronidazole, disulfiram-like action. For the remember the disulfiram action, what we find out the main laser trick? CZMP, cefomendol, cefotitan, and cefoperazone comes under the cephalosporin, which have the disulfiram-like action. That we have the griseofulvin, metronidazole, and procarbazine. Okay, go on. Next question, what we have? Find out the answer quickly, fast. Okay, let's speed up our process. Which of the following is not a sign of the inflammation? Inflammation. Fever, increase in ESR, erythrocyte sedimentation rate, decrease in ESR, eosinophils, changes in the number of WBC. Do it fast. Actually, what is inflammation? Firstly, go on. During the inflammation, there are the lot of the signaling protein formation in the cells, as well as it's a complex, very complex process where the foreign substance like the bacteria, virus causes the inflammation. Sometimes there is the WBC, which is the firstly hampered due to the inflammation, and other substance also. So what we have here, the first symptoms which develops: pain, heat, redness, swelling, loss of function, changes in the number of WBC, increase in eosinophil sedimentation rate, increase in ESR. So here fever can be there, increase in ESR can be there, change in number of WBC, but decrease in ESR, no, this never happened. Here increase in ESR will happen during the inflammation. So C answer will be the incorrect. Pain, heat, redness, swelling, increase ESR, number of WBC, loss of the function of the cell. Okay, next. Read the following statement regarding the therapeutic index. Actually, therapeutic index is the measurement for the safety. Okay, firstly it comes with the safety. A ratio used, or what is the formula of the therapeutic index? So simply remember the TILE means therapeutic index is equal to the LD50 divided by the ED50. Okay, So here TILE, T-I-L-E, TILE. Now, a ratio used to evaluate the safety and usefulness of a drug for the indication. Do you really think it's true? No, actually it's not. What ratio used to evaluate the safety? Sorry, okay. Therapeutic index mainly measure directly proportional to the safety of the drug. So if the therapeutic index is high, that means drug is safer. A ratio used to evaluate the safety and usefulness of drug and for the indication. Okay, it's true. A ratio used to evaluate the effectiveness of drug. Do you really think with the safety and efficacy, safety, you can find out, evaluate the effectiveness of a drug? Directly it's not, but yes, with the ED50 you can find out the effectiveness of the drug. So here actually it's incorrect. A ratio used to evaluate the bioavailability. No, never, not. So the correct answer will be the first only true. 2 and 3 are false. So B answer will be the correct here. Yes, Rohit, you can say 60 is good one. Okay, so here first statement is correct, but second and third is not correct. Why, sir? Because it is mainly used for the safety. Yes, effective dose ED50 is mainly specified for evaluation of the effectiveness, but mainly we can say the therapeutic index is mainly for the safety purpose of, correct? Safety purpose. So that's why therapeutic index is directly proportional to the safety of a drug. Okay, next. Read the following statement regarding the competitive antagonist. Competitive. Suppose there is an enzyme which have a binding site, active binding site, and there our agonist and our antagonist which have the structural similarity, they are fighting to bind with each other on the same site called as the competitive antagonist, correct? Interact with the receptor and produce the submaximal effect. Is it true? Not at all. Sir, during the competitive antagonist, there will be the no any action. So how it can be the submaximal? That mainly happen with the partial agonist. Bind to the same receptor site and progressively inhibit the agonist response. Yes, it's true. Okay. Bind to the non-specific site of the tissue. No. When there is the non-specific site, that will called as the non-competitive. Correct? When the antagonist bind at the allosteric site, that is called as the non-specific, and it will be the non-competitive allosteric site, not on the same active binding site, competition with the agonist. So P and R is incorrect while Q is true. So C answer will be the correct answer. Very good, my dear students. You are really doing very well. And yes, I am proudly announcing this year also, like in the last year, as Tarun have made the under 100 rank from the GDC South Belt, this year also we are going to have 3 to 4, 5 students at least which are going to make the rank under 50. I can easily announce those names, but wait and watch. You have only 4 days in your hand. Complete the question series as much as you can and try to give a last quick superficial view for your all the complete revision notes. Okay. Next, read the following statement regarding the methacholine. Methacholine. What we remember actually the word methacholine, that have the M, they bind with the myocardium. Myocardium present on the heart, and in the heart the M2 receptor is present. Correct? So find out methacholine is used in tachycardia. Yes, methacholine bind on the M2 receptor, which is actually the GI protein mediated receptor, and it causes the bradycardia. So yes, we can say it can cause the tachycardia. Okay. Methacholine is act on the alpha-2 receptor. Methacholine is used in bradycardia. No, it causes bradycardia. Methacholine act on the M2 receptor. You have the P and S is true while R and Q is false. The correct answer will be the C answer. You can easily find out. Remember the word, what is actually methacholine? bind on the M2 receptor myocardium, bethanyl bind on the bladder M3 receptor, and the carbachol, C means carbachol, C means common, it can bind with the common action nicotine and muscarine. Which of the following statements are true? Endogenous catecholamine includes adrenaline, noradrenaline, dobutamine. Simple. Endogenous catecholamine and adrenaline, noradrenaline, dopamine. Exogenous catecholamine, so your ID, isoprenaline, dobutamine. And non-catecholamine, you can sit on the seat, means salbutamol, ephedrine, amphetamine, tyrosine, tyramine. These are the non-catecholamine. Catecholamine are synthesized from the amino acid tyrosine. Yes, tyrosine hydroxylase is the specific and the rate limiting enzyme during the catecholamine synthesis. Vesicular catecholamine uptake is inhibited by the reserpine. What a good question. Yes, here all are correct because all the meanings. Remember the synthesis of the adrenaline, how it actually happens here. Firstly, what happened? The tyrosine, which form from the phenylalanine inside the liver, that's why it's called as the semi-essential. So tyrosine comes into the adrenergic neuron, where tyrosine converted into the levodopa by the enzyme called as the tyrosine hydroxylase, levodopa converted into the dopamine by the enzyme dopa decarboxylase. Dopamine enter into the vesicle, where reserpine inhibit the vesicular uptake, and dopamine further leads to the formation of the noradrenaline by the dopamine beta hydroxylase, and noradrenaline further form the adrenaline by the N-methyl transferase, and noradrenaline will form, that will release on the alpha and beta receptor. Tyrosine hydroxylase enzyme, it's a rate limiting enzyme. Okay, so here is the process you can easily read out, but I hope all the things comes in your mind. Okay. Neurogenic shock is characterized by neurogenic shock. Okay, go on. There are 4 types of the shock: anaphylactic shock, cardiogenic shock, neurogenic shock, and hypovolemic shock. Remember this word. Now, for the anaphylactic shock, you have the drug of choice, that is the adrenaline. For the cardiogenic shock, you have the dopamine. For the hypovolemic shock, which actually develops due to the overuse of the diuretic, at that time the plasma volume expander can be used. And for the neurogenic shock, there is the inhibition of the sympathetic nervous system called as the neurogenic shock. Activation of the sympathetic? No. Activation of parasympathetic, inhibition of the sympathetic nervous system called as the neurogenic shock. Sympathetic inhibition. So actually, what happened? When you just see the line in front of you, what has happened? Sympathetic system activated inside our body, and yes, we are in the fear situation, fight, flight, fight situation. But suppose if your body completely get in the shock, neurogenic shock, no sympathetic system stimulation, that will be the neurogenic shock. So here is the neurogenic shock. Hypovolemic shock, decreased circulatory blood volume. Cardiogenic shock, cardiac pump failure. Septic shock, that is the inflammatory symptoms, or we can say the infectious symptoms. Neurogenic shock, decrease in sympathetic outflow. Muscarinic cholinereceptor agonist may induce vasodilation largely by causing the release of the endothelial. M3 receptor, which is actually the GQ protein mediated, but here is another important factor. It activated the EDRF, called as the endothelial dependent relaxing factor, which further leads to the development of nitric oxide that activate the CGMP, and that CGMP carried out the formation of the causes the relaxation of the dephosphorylation of the phosphorylated myosin light chain kinase, and that causes the relaxation. So here is what is the correct answer. We have the nitric oxide. How it can be the D? No, it's the nitric oxide. That nitric oxide causes the relaxation. Always. Only in the small blood vessels, means capillary only, there will be the nitric oxide. And yes, this nitric oxide is called as the non-adrenergic, non-cholinergic neurotransmitter formed at the site immediately. So it mainly cannot be stored. It formed by the three enzyme called as the nitric oxide synthase. These are the three types: NOS1, NOS2, NOS3. NOS1 responsible for the mainly present on the rat brain. NOS2 mainly present on the macrophages, and NOS3 mainly present on the endothelial cells. The correct answer, you have find out that. Okay, next one. Which of the following anticholinergic is not a tertiary amine? Not a tertiary amine. So during the anticholinesterase classification, you have the reversible, irreversible. Under the reversible, you have the lipid soluble and water soluble. Or the tertiary amine derivative are called as the water soluble, where we actually remember the word that is called as the PEN, pyridostigmine, hydrophonium, neostigmine. While all the lipid soluble, these are the great DP means galantamine, rivastigmine, tacrine, donepezil, physostigmine. So these are the lipid soluble, but that is for the anticholinesterase. Here what we have the question, that is the anticholinergic. Under the anticholinergic, there are also the tertiary amine derivative and quaternary amine derivative. So during the tertiary amine derivative, what we have? Dicyclomine. Yes, here is the dicyclomine. Here is also we have the 𝘿𝙬, piperazine. But this glycopyrrolate, it's also the tertiary amine. This one is tertiary amine. It's also tertiary amine. But glycopyrrolate, which act as the pre-anesthetic medication also, that is the quaternary amine derivative, and the question was not a tertiary amine derivative. Okay, so glycopyrrolate, here dicyclomine, 𝘿𝙬, piperazine, tertiary amine. Propanthyline, oxyphenonium, clidinium and glycopyrrolate are the quaternary ammonium compounds. Which of the following is a mixed alpha and beta blocker? Labetalol, carvedilol, labetalol. Mixed alpha and beta agonist, not antagonist. Dobutamine, mainly active on the beta 1. Felodipam, epinephrine, phenylephrine. Phenylephrine mainly act on the alpha 1. So epinephrine and felodipam. You know very well, epinephrine means adrenaline act on the alpha as well as act on the beta. So it have the action on the both. So correct answer will be the C. Here, epinephrine, norepinephrine active on the alpha beta both as well as norepinephrine. Dobutamine, beta 1, isopropanol, beta 1, beta 2 as well as beta 3. Albuterol, terbutaline, these only active on the beta 2. Dopamine mainly have the dopaminergic action, mean active on the dopamine receptor, lesser on the beta and alpha. But felodipam mainly active for the dopamine 1D1 receptor. Respiratory acidosis may be caused by. Go on. Have you heard any time that is the emphysema? Alveolar sac inflammation, emphysema. Yes, emphysema is the situation where actually what happened, that is called as the respiratory acidosis. While starvation, that is the different thing. Hyperventilation or vomiting, no. Emphysema, that leads to the respiratory acidosis. It is the condition that occurs when lungs can't remove enough to the carbon dioxide produced by the body. Means we have the damage of our alveoli. So carbon dioxide cannot be exhaled out from the body. So inside the carbon dioxide concentration increases, that further develop to the respiratory acidosis. And that mainly happen due to the emphysema. This respiratory acidosis can occur impaired neuromuscular function, due to air obstruction. It may be caused due to the chronic bronchitis, asthma, emphysema, or restricted thoracic movement. Which of the following is a relatively cerebroselective anticholinesterase to afford symptomatic improvement in Alzheimer? Great DP. Remember the word? Great DP. But physostigmine that have mainly the mitotic action, act on the glaucoma, galantamine, rivastigmine, tacrine, donepezil. These are the 4 drugs which used in Alzheimer as a anticholinesterase. So correct answer will be the donepezil. Can you easily find out the answer? Yes. Okay. Next question. Everyone, focus on the question and answer carefully. Do it fast. Drug masked correct mechanism of action. Timolol, it mainly reduces the production of the aqueous humor, increases scleral outflow. Pilocarpine increases trabecular outflow because pilocarpine causes the meiosis, increases trabecular outflow. Latanoprost increases uveoscleral outflow, so mainly do not have any action on the production of the aqueous humor. And brimonidine increases trabecular outflow. No, it's only used have the ability to reduce the production of the aqueous humor. So here only B answer is the correct answer. That yes, alpha binder, beta blocker, carbonic anhydrase inhibitor are bad. Means alpha binder, epraclonidine, brimonidine, beta blocker mainly timolol, and carbonic anhydrase inhibitor are bad. Brinzolamide, acetazolamide, dorzolamide, they reduces the aqueous humor production. While on the trabecular outflow, the drug mainly act, that is the mitotic agent as well as the alpha 2 agonist. And in the uveoscleral outflow, prostaglandin means PGF2 alpha agonist, latanoprost and bimatoprost act. Good. Next, it is weak calcium channel blocker that inhibit the sodium channel as well as it is effective in prophylaxis of migraine. Weak calcium channel blocker that inhibit the sodium channel as well. Give me the answer. Do you really think verapamil have any type of the sodium channel blocking property? No, only calcium channel blocking. Lidocaine, only sodium channel blocker. Gabapentin, that is the GABA agonist. But yes, flunarizine, it's a calcium channel blocker used in migraine as a prophylactic agent and also can block the sodium channel. If you can find out this type of question, answer only from here. As you all know, the prophylaxis of the migraine can be carried out by the 4 drugs A, B, C, D. Means anticonvulsant, beta blocker, calcium channel blocker, and antidepressant. So under the calcium channel blocker, you can find out the flunarizine. Under the beta blocker, that is the propranolol, is the drug of choice for the prophylaxis of migraine. Which of the following is the recommended first line urate lowering therapy? Means the drug which can lower the uric acid, urate lowering therapy. So simple, xanthine oxidase inhibitor. Give me the answer. Xanthine oxidase inhibitor, allopurinol. Here also the febuxostat, probenecid, that is the second line. Okay, and benzobromomarone, no. The correct answer will be the allopurinol. Why, sir? Actually, it's also the xanthine oxidase inhibitor. But why only allopurinol? Because allopurinol have lesser adverse effect and mainly used for the lowering of the uric acid. So, xanthine oxidase inhibitor that mainly used. All of the following effects are produced by the inhibitor of the prostaglandin synthesis. Except. Find out the word. Except. All of the following effects are produced by the inhibition of the prostaglandin synthesis. Uric drug. Yes, that's a uric, and it's second line drug for the treatment of the gout. So as you all know, prostaglandin causes the contraction of uterus. Prostaglandin can causes the fever, pain, as well as the inflammation. So prolongation of bleeding time. Why, sir? Yes, it's true. But why? As you all know, prostaglandin, which is mainly causes the production of the thromboxane also, coagulation of the platelets also. So it's true. Prolongation of labor, because prostaglandin in here, inhibitor of prostaglandin, you can easily correlate it with the NSAID. Now give me the answer. Aspirin can prolong the bleeding. Am I right? NSAID can prolong the labor. NSAID can cause the gastric mucosal damage and develop the ulcer. These all can happen. But prolongation of prothrombin time, no, it's not true. It's not true. You have to find out the except. NSAID can cause all except, because prostaglandin inhibitor, we can easily say the, yes, that is the NSAID, COX inhibitor. But individual drug also there, but mainly we can say the NSAID. Which of the following occurs in aplastic anemia? Aplastic anemia. What is actually aplastic anemia? So aplastic anemia means stoppage of the formation of the new blood cells. When our body failed to produce the new blood cells, that is called as the aplastic anemia. And during the aplastic anemia, all blood cells, not only RBC, not only WBC, not only thrombocytes, all. So there will be the thrombocytopenia, there will be the pancytopenia, there will be the leukopenia. You can easily find out with the one word, as you all know about the penia and leukemia. Okay. So here, when there is the suffix added mia, that means increase. When the suffix added, that is the penia, that means decrease. Thrombocytopenia, that means decrease platelets. Pancytopenia, there will be the decrease all the WBC. Leukopenia, decrease WBC. Pancytopenia, there will be the reduce of the RBC also. So all of these can be happen there during the aplastic anemia. Uncontrolled bleeding. The condition leave you fatigue and more prone to infection, and uncontrolled bleeding will be there. It may happen when your bone marrow does not enough red and white blood cells and platelets, that is the aplastic anemia. Prostaglandin used in the treatment of the peptic ulcer. Okay. Come very soon. What is here? Prostaglandin used in the treatment of the peptic ulcer. Monica, what is pancytopenia? Nowadays, Monica, there is a very common word is going on, that Pan India star. Have you heard about that? Pan India star, like Prabhas. Okay, we know very well and we love her movie 𝙂𝙂. Okay, Pan India means all over the India. So here, pancytopenia means all the cell. When only WBC decreases, that is the leukopenia. When only platelet decreases, that is thrombocytopenia. When RBC, WBC and platelets, all cells decreases, called as the pancytopenia. Okay. Next one, peptic ulcer. Know very well misoprostol under the direct classification of the ulcer. Prostaglandin analog misoprostol uses for the ulcer, peptic ulcer. Okay, next, A person goes for the okay, let's just speed up. Person goes to the ophthalmologist. He has a problem of reading books because he is not able to contract his during the reading of book. Our ciliary muscles accommodate our pupil, but when the ciliary muscles contraction is not there, so what happened? We cannot adjust our lens or adjust our pupil. So that's why ciliary muscles contraction is very important. So correct answer will be the ciliary muscles. When there will be the no ciliary muscles contraction, so our lens cannot balance all the light. So lens become the rounder, and for the proper eye vision, the lens should be the flatter. Okay, next one. Which of the following prevents internal reflection of light inside the eye? Okay. Dear students, believe me, these are very important question. Don't miss any question because it have all the things: pharmacology, pathophysiology, anatomy, because the question pattern for the NBMS 2024 will be the similar like this, and in GPAT 2025 also the question will come from this point. Okay. Following prevent internal reflection of light inside the eye. Okay, let me help you. There will be the no cornea, there will be the no retina. Now give me the answer. Prevents internal reflection of eye. Actually, retina is mainly important for the proper putting the light in the retina. That's why the image formation will be there. But it's what is there? Prevent internal reflection of eye, that is called as the choroid plexus. Have you heard about the choroid plexus? Yes, these choroid plexus, here is the choroid plexus, that mainly help for the prevention of the reflection of the light inside the eye. So all the light can be directly put on the retina. Selective COX-2 inhibitor differ from the non-selective COX-1 COX-2 inhibitor in that they are anti-inflammatory but not analgesic, do not bring fever down, have no renal effect, do not inhibit platelet aggregation. Have you heard about thing that COX-2 is mainly responsible for the bleeding? No. That's why selective COX-2 inhibitor are mainly used during the ulcer like 𝘿𝙄𝙎𝘾𝙄𝑼, pericoxib and 𝘿𝙄𝙎𝘾𝙄𝑖b. Why? Because they do not affect our platelet aggregation. Both have the features. They can bring down the fever. They have the no renal effect, are anti-inflammatory, but also analgesic also. But the main difference is that COX-1 responsible for the inhibition of the platelet aggregation, but COX-2 never affect the platelet aggregation. So correct answer will be the D answer will be here. Selective COX-2 inhibitor, cytoprotective, decreases HCl secretion, increases the mucus production. So COX-1 enzyme, okay, it have the cytoprotective vasodilation effect on the kidney also and enhance the platelet aggregation. But COX-2 do not have the any effect on the platelets. Find out the correct statement regarding the acetylcysteine. This one is drug which comes under the category of the mucolytic, a derivative of the alkaloid vasoacin obtained from the Adrenotoda vesica. It can be administered orally or as by inhalational or in solution. From also on the basis of need and condition of the patient. It helps to open the disulfide bond mucoprotein present in the septum. Okay, it's called as the mucolytic, and it's also can be given by orally, inhalational or in the solution form. It helps. Mucolytic means break down the disulfide bond, but a derivative of the alkaloid vasoacin obtained from the Adrenotoda vesica. Can you say the acetylcysteine is the Adrenotoda vesica vasoacin derivative? No, that's the bromohexane, not acetylcysteine. So this one is incorrect. All are correct. So here what we have, PRS is true, but Q is incorrect. Very good. If you can find out these type of the silly word, silly mistakes during your study or during your question solving ability, so you can easily crack any exam. in the form of it. Given below are two statements. One is labeled as assertion and another labeled reason. Okay. Noscapine and dextromethorphan is helpful during the cough for the patient of cardiac surgery. Yes, it may be used. Antitussive are the drug that act on the CNS to raise the threshold of the cough center or act peripherally in the respiratory tract to reduce the tussle impulse. Okay, good one. That's why during the cardiac surgery, the impulse should be the high, so cough cannot be there, so we cannot, so the cardiac surgery can be easily happen. So yes, correct. Assertion is also true. Reason is also true, and reason is the correct explanation for the A. So A answer will be the here correct one. Both are true, and it's a correct explanation also. Which of the following is true about the 𝘎𝙕-glucose, montelukos, 𝘎𝙕-glucose? These are the leukotriene receptor antagonists used in asthma. Yes, it can be administered only given in prophylaxis of asthma and cannot be given in acute attack. Main side effect 𝘎𝙕-glucose syndrome, all are true. Yes, here all of them are true. Why? It's administered orally. I hope you have taken the Monty LC sometimes, and it is mainly given for the prophylaxis of asthma. It's direct no role in the treatment of the asthma. Yes, you can take it as an anti-allergic also. Main side effect is the 𝘎𝙕-glucose syndrome. Yes, 𝘎𝙕-glucose syndrome is the major adverse effect during the treatment with the montelukos and 𝘎𝙕-glucose. All are true. LOX inhibitor is xylitol. 5-LOX inhibitor, 5-lipoxygenase inhibitor. The exchange of the gases between the external environment and the lungs is. The exchange of the gases between the external environment and the lungs is. Okay, go on. Respiration, external respiration, cellular respiration, or the none of the above. Give me the answer fast. Sir, obviously, the exchange of gases, internal and external. So, external respiration. It's not only the respiration. B. So, sir, when then what is the respiration? Here comes external respiration, the uptake of oxygen and exertion of carbon dioxide in the lungs. While internal respiration means the oxygen and carbon dioxide exchange between the cell and capillary. Here what happened? The exchange of gases between the external environment and the lungs. Remember what happened? So here we have the lungs, right lungs and left lungs, and with the trachea, the oxygen and carbon dioxide exchanges through the blood, and when from the lungs to the external environment, that is called as the external respiration, and from the blood to the lungs, that is called as the internal respiration. So here external respiration from the lungs to the external environment. Okay, next. All of the following statement about the use of glucocorticoid in asthma is the true except. Okay, Hitesh, just wait. Very soon it's starting. Go on. All of the following statement about the use of the glucocorticoid in asthma is true except reduces bronchial inflammation and hyperactivity to stimuli, have delayed onset of action, given as prophylactic medication used alone or in combination with the beta agonists, they are the bronchodilator. I hope the easiest question one is here. Yes, Hitesh, I will be there from 11 p.m. Do you really think bronchodilator? It's a really bronchodilator. Glucocorticoid is bronchodilator. Who think that glucocorticoid is bronchodilator? Just leave all the options. How it can be the possible one? Under the asthma drug classification, there are only three classes of the bronchodilator. First one, what we have, that is the beta 2 agonist. Then what we have, that is the anticholinergic and methylxanthine derivative. How this one is possible? The question is between the external and lungs, but not from the external to the lungs. The question is between the external and lungs. Dear Sana, external and lungs. That means from lungs to the external environment. The meaning of that question is a simple one. From blood to the lungs, that is the internal respiration. Two words is there and combinedly it called as the respiration. Okay. So here it's wrong one and you have to find out the except. Okay. Glucocorticoids are not bronchodilator. Yes, they have the anti-inflammatory action. They also are used as the immunosuppressant also. They are mainly used as the adjunctive in the asthma treatment also, but not a bronchodilator. The best stage to study the shape of the chromosomes. Shape of the chromosomes. Prophase, metaphase, anaphase, telophase. How it can be there? Metaphase. During the metaphase, the chromatin threads are totally apart from each other, so we can easily study here. Centrochrome, that is the telocentric, acrocentric. So during the metaphase, what happened? Here is the metaphase. During the metaphase, what happened? Actually, the chromatin threads are apart from each other. That's why that is the best steps to study about the chromosomes. Murmurs are generally heard in disorder affecting the following. That is mainly murmurs are generally heard in disorder affecting the following. Actually, here is the two things. What is murmurs? Why it happened? And the reason behind that. Yes, Sujal, yes. Okay, give me the answer. Last year that was the question, that murmurs is the side effect or the side effect of the heart valves, and that happens mainly due to the disorder of the erythropoietin. So you can easily correct. Yes, erythropoietin related with the blood, that means RBC, and that is the major disorder of the erythropoietin can leads to the murmur. So the hormone erythropoietin stimulates the red blood cells production, and here EPO is carried out bone marrow where it triggered the production of the RBC, and it's a recognized erythropoietin hormone that is mainly used for the study of the murmur or the affecting erythropoietin synthesis can lead to the murmur. Yeah, means heart wall defect. Okay, next match the following. T3 and T4. T3 and T4 mainly synthesized, stimulated by the TSH, and TSH mainly stimulated by the TRH. Correct? Because what happened from the hypothalamus, there is the release of the TRS, thyrotropin releasing hormone, that comes to the pituitary gland. From pituitary gland, there is the release of the TSH, and that TSH control the thyroid gland, and from thyroid gland, there is the release of the T3 and T4. Now TRH. When this TRH, when we perform the exercise, we are under the stress condition, then there is the need of the T3 and T4 or T3 and T4 hormone, because that leads to the maintenance of the BMR, basal metabolic rate. So yes, stimulated by the exercise and stress, and thyroid hormone synthesized by the thyroglobulin, means QRSP. The correct answer will be the A answer. Okay. T3, T4 stimulated by TSH, TSH stimulated by TRH, TRH stimulated by exercise and stress, and thyroid hormone synthesized by the thyroglobulin. Up to the 10, I hope. Next question. Which of the following is not an oxytocic agent? Oxytocic means contraction of the uterus. So you can easily find out the ergometrin, you can easily find out the prostaglandin, you can find out the oxytocin, but oxyprenylin, that is the that's do not have any action on the uterus, so it's not a oxytocic, else apart it's a relaxing agent, not an oxytocic agent. You can find out oxytocin, desamino-oxytocin, 𝘿𝙄𝙎𝘾, prostaglandin 𝘿𝙂𝙎, ethacridine and quinine, these are the oxytocic, means uterine contraction. What is the first line drug for the patient with type 2 diabetes mellitus and obesity? Have anyone remember the word? Most. Metformin given for the obese patient because it leads to the weight loss. Sulfonylurea given to the thin patient, that leads to the weight gain. Here what we have? Obesity. So definitely what we give? Metformin. So for the obese patient, we give the metformin because it leads to the weight loss. Simple. Most. One word, many answer. Remember the word most. Yes, there will be the metallic taste. Yes, there will be the lactic acidosis adverse effect. But mainly lactic acidosis was there in the fenformin. That's nowadays banned. FSH and LH have the pulsatile release that is regulated by which hormone? FSH and LH regulated by the GnRH, gonadotropins releasing hormone from the hypothalamus. Next one. Misoprostol has a cytoprotective action on the gastrointestinal mucosa because of one of the following. Simply, it enhances the bicarbonate production as well as the mucus production that lead to the production of the mucosal membrane. Enhance secretion of mucus and bicarbonate. So that's why during the treatment of ulcer, actually what we use? Prostaglandin analog misoprostol, which leads to the formation of mucus as well as the sodium bicarbonate. GnRH agonist Ralin and antagonist will be the Ralix. Good. Which of the following glucose transporter is the new drug target for the management of type 2 diabetes mellitus? So there is a one glucose transporter which is present on the kidney, that is called as the sodium glucose transporter. For that inhibition of that transporter, the newer drug are used, that is called as the gliflozin, dapagliflozin, canagliflozin. So there is major adverse effect associated with the sodium glucose transporter inhibitor, that is called as the UTI, urinary tract infection. Sodium glucose transporter, SGLT2. Have you heard about the drug? Yes, super GDC will be there. SGLT2 inhibitor, that is the dapagliflozin, canagliflozin. Yes, all the gliflozin class drug. Canagliflozin, dapagliflozin, empagliflozin, sodium glucose transporter inhibitor. Okay, next one. Nodule of the spleen contain. Kanchan, the simple thing is that if I am working, or the team of GDC working for all of you to motivate you, to enhance or encourage you that yes, you can easily not only qualify but also get the best rank in the upcoming exam. Now it's your turn, you have to give your best. Simple, the rule is that. Okay. Nodules of spleen, red pulp and white pulp, hormone producing sleep cells. How? Glucose is stored glycogen? No, it have the red pulp and white pulp. Here is the spleen, that having the red pulp and white pulp. Here is the red pulp with the white pulp, and spleen, this is the composed of the connecting tissue, spleen. Okay, go on. Next. Find out the correct statement regarding the peripheral acting skeletal muscles relaxant. Intravenous injection of the non-depolarizing blocker rapidly produces muscles weakness. Intravenous injection of non-depolarizing means competitive blocker, means 𝘂𝙂𝙎𝙎𝙎𝙬. Okay. Intravenous injection of the non-depolarizing blocker rapidly produces the muscles weakness. Yes, it can be there. Competitive neuromuscular blocker, competitive neuromuscular non-depolarizing blocker produces some degree of the ganglionic blockade, little bit. Yes, it can be there. 𝘂𝙎𝙎𝙎, yes, it have the histamine release property. 𝘂𝙎𝙎𝙎 produces significant rise in blood pressure. No, actually, when there is the histamine, there will be the fall in blood pressure, not in the rise in blood pressure. They have no central effect, correct? They have no central effect. All the correct except S. S is incorrect. Okay. Here, when there is a histamine release, that histamine causes the blood vessels dilation, lead to the fall in blood pressure, significant fall in blood pressure due to the histamine release and ganglionic blockade. Fall in blood pressure will be there. Which of the following are correct regarding the interaction of the peripherally acting muscles relaxant? Okay, I hope there is some question mistake in the question. Verapamil and other calcium reduces the activity of peripherally acting muscles relaxant. General anesthetic potentiate the competitive blocker. Anticholinesterase peripherally, verapamil and other calcium channel blocker reduces the. Okay, no, the question is correct. Okay, go on. Verapamil and calcium channel blocker produces the activity of reduces the activity of peripherally acting skeletal muscles relaxant. Obviously, because skeletal muscles relaxant, that means it have to control the relaxation or reduce the contraction, so relaxation will be there. As well as calcium channel blocker also perform the same thing. But what we have? Verapamil, that is L-type calcium channel blocker, and L-type calcium channel blocker mainly present on the hard as well as on the smooth muscles, but very less on the skeletal muscles. So yes, it can reduce. It can never reduce the action of the skeletal muscles relaxant. Do you really think skeletal muscles, cardiac muscles, and smooth muscles all have the same property? Not at all. Verapamil can act on the smooth muscles, on the cardiac muscles, but never on the skeletal muscles. So how it can reduce the action? No, incorrect. General anesthetics potentiate the competitive blocker. General anesthetic like benzodiazepine potentiate central skeletal muscles relaxant. Yes, it can potentiate the action. Anticholinesterase reverse the action of the non-competitive blocker. Anticholinesterase, remember this word, neostigmine. Note down as such, neostigmine recover the action of the 𝘂𝙎𝙎𝙎𝙎. Means once we provided the neostigmine, that lead to the increased concentration of acetylcholine and inhibited the metabolism of acetylcholine. When there is the increased acetylcholine, that can reverse the action of the 𝘂𝙎𝙎𝙎 because there is the competitive antagonist. But during the non-competitive antagonist related with the succinylcholine, we can never recover the action. So it's incorrect. Diazepam propranolol and quinidine intensify competitive blocking. Yes, it can. So Q and S are true, while P and R is incorrect. Where is the option? Here, only Q and S. How many students have given the correct answer? Verapamil, ankle edema, that's the adverse effect. Constipation will be there, that's also the adverse effect, but no any relation with the skeletal muscles relaxant. So here, the answer. Verapamil and other calcium channel blocker potentiate the activity of the peripherally acting skeletal muscle. General anesthetic potentiate the competitive blocking. Anticholinesterase reverse the action of the competitive blocker, not the non-competitive. Diazepam, propranolol, pyridine intensify the competitive blocking property. Match the following drug with their classification. Mephension congener, chlormazanone, benzodiazepine, diazepam, GABA B agonist, baclofen, centrally acting skeletal muscles, alpha 2 skeletal muscles relaxant, tizanidine. So here QSPR, the answer is there. Direct classification of the centrally acting muscles relaxant. How it can be the A? No. Select the correct statement regarding 𝘂𝙎𝙎𝙎𝙬. It is short-acting, peripherally acting skeletal muscles relaxant. It's a long-acting. It is a competitive blocker of the nicotinic acetylcholine receptor present on the neuromuscular junction. Yes, you can say. At the muscles end plate, it increases the frequency of the sodium ion channel opening. It causes the prominent histamine release. Yes, it can be there. But here P is incorrect. So when P is incorrect, so obviously these two can never be happen, and it's also cannot be happen because P is correct. So only option C you have. That means Q and S are correct. While it never act on the sodium channel, it is long acting. So the C answer will be there. Okay. 100 MCQs. 100 MCQs. Read the following statement regarding the statement central nervous system. Glutamate is excitatory neurotransmitter due to excessive glutamate release. Yes, it's excitatory neurotransmitter. Psychosis is induced due to the increase in dopamine level in the brain. Depression is induced due to the decreased serotonin and noradrenaline. Parkinson is dopamine and decreased acetylcholine. No, this one is incorrect. S is incorrect. Else apart, all are true. PQ are correct while S is incorrect. Let's do it this speed. Read the following statement regarding the general anesthetics. In stage 1, patient is conscious but drowsiness. In stage 2, patient loses consciousness, increases heart rate and blood pressure. Stage 3, also known as the surgical anesthetics agent, and muscles are relaxed. In stage 4, pupils are dilated, muscle tones are increased, and stages of medullary paralysis. All are correct. Stage 3, also known as the surgical anesthetic, and muscles are relaxed. Yes. How it can be? Only one option will be correct. Here all are correct. Why C? Why D? Actually it's C. Stage 3, surgical anesthetics, muscles relaxes, stage of delirium, increase heart rate, blood pressure, patient is conscious but drowsiness. Actually the option was given. All are correct. Match the following and their mechanism of action. Benzodiazepine increases the frequency of the chloride ion channel opening. Barbiturates increases the duration of the chloride ion channel opening. Zopiclone, that is the non-benzodiazepine hypnotic, while Remetion is the melatonin receptor agonist. QRSP. Here is the answer. Correct? Binding site like benzodiazepine, alpha gamma, barbiturate, beta, alpha, mainly alpha beta, benzodiazepine only on the alpha position, non-benzodiazepine. Read the following statement regarding the lemotriazine. Lemotriazine, it is a newer anticholinergic having carbamazepine-like action. What? Lemotriazine, it have the sodium channel blocking property as well as the sodium channel inactivation, yet it have. Lemotriazine, broad spectrum anti-epileptic drug. Lemotriazine is broad spectrum. Prolongation of sodium channel inactivation and suppression of high frequency of firing has been demonstrated. Facilitation of the GABA mediated chloride ion channel opening. No. Yes. Actually, here it will be not there because here is Q and S. So C answer will be there. But since here there was a mistake, P, R are correct while Q, S are incorrect, then it can be okay. Because lemotriazine is a valproic acid mainly is the broad spectrum anti-epileptic drug, not as much as lemotriazine. Facilitation of iron, no, there is the prolongation of the sodium channel inactivation. Okay, next one. Which of the following anti-Parkinson drug directly activate dopaminergic D2 receptor? Pramipexole. 4 drug are there: bromocriptine, pergolide, ropinirole, pramipexole, entacapone, COMT inhibitor, salazilin, MAOB inhibitor, benzodiazepine, dopa-decarboxylase inhibitor. So pramipexole will be the correct answer. Following are the partial agonist of the dopamine receptor. Partial agonist of the dopamine receptor. Have you heard about the partial agonist of the dopamine receptor? Sulpride, actually levosulpride, that is comes under the D2 antagonist, haloperidol D2 antagonist. So here aripiprazole and apomorphine can be there as a agonist of the dopamine receptor. We can call it as the partial agonist aripiprazole, brexpiprazole, cariprazine and apomorphine that have the partial agonistic action. Which of the following antipsychotic in excess dose is responsible for the cardiac arrhythmia? Excess dose antipsychotic. Which drug causes arrhythmia? QT interval prolongation. Clozapine. Yes, clozapine that have the autonomic dysfunctioning can play a role and yet it can lead to the cardiac arrhythmia. Else apart, it's a choice. Which of the following is not an epileptic agent? Phenytoin epileptic, topiramate epileptic, carbamazepine anti-epileptic, but flunarizine, no, that's prophylaxis of migraine, not a anti-epileptic drug. Which drug act through the alpha subunit of GABA? Alpha subunit of GABA. No. Benzodiazepine, alpha gamma. Barbiturate, alpha beta. Now here is the confusion. What the option you will find out? Remember, only beta, GABA mainly bind on the beta side. Alpha gamma interface, there will be the benzodiazepine, while beta gamma interface there will be the barbiturate, or we can say the alpha beta. But here what you can find out, the alpha subunit mainly bind with the benzodiazepine, or we can say non-benzodiazepine. Suppose in this question the one option should be there, non-benzodiazepine. If the option is non-benzodiazepine, then it will be the perfect answer, because non-benzodiazepine bind on the alpha subunit. Day trip drug, flunitrazepam. Okay, sorry. Here is the already option is answer is given. Vigabatrin, as its name indicate, GABA transaminase inhibitor. GABA transaminase inhibitor. GABA transaminase inhibitor. There is one drug also which inhibit the reuptake of GABA called as the tiagabine. There is a one drug which facilitate the release of GABA called as the gabapentin. So that will be the newer drug. Vigabatrin, gabapentin, as well as what we have, tiagabine inhibit the reuptake of the GABA. As the following drug with their site of action. Come on. Acetazolamide, carbonic anhydrase inhibitor, mainly active on the PCT, proximal convoluted tubule. Options are changed. Acetazolamide act on the PCT, spironolactone act on the late DCT, mannitol act on the descending limb of loop of Henle, Remeltion, that's a pineal gland melatonin receptor agonist and mainly act on the MT1 receptor or MT2 receptor. Here this one will be the correct answer, but else apart all are incorrect because this is not related with the options we have here. So question is incorrect, or we can say the options are incorrect. I'm having my semester exam on 22, 20, 22, 24, 26. So should I revise from MCQ series or apart from a module? My best suggestion will go with the question only. Identify the diuretic which can cause the hyperuricemia, tend to raise the serum calcium and also causes magnesium depletion. There are so many times you get confused between the furosemide adverse effect and thiazide adverse effect. Actually, there is only one difference. Furosemide causes the hypocalcemia and thiazide causes hypercalcemia. Okay, else apart, all are same. It also causes the hypokalemia, hypomagnesemia, hyperuricemia, hyperglycemia, as well as hyperlipidemia. Same here also. The major difference one was only furosemide causes hypocalcemia and thiazide causes the hypercalcemia. Now you have question, identify the diuretic which causes the hyperuricemia, both can cause, tend to raise the serum calcium level. Here is the option, means your answer. Serum calcium level increases by the thiazide. So here is the option, chlorothiazide. Yes, Akshay. Given below are diuretic and their possible mode of action. Metalazone, that is the thiazide-like derivative. Carbonic anhydride inhibit the transport of the chloride at ascending limb of loop of Henle. Inhibition of the reabsorption of sodium in distal renal tubule. No, not at all. Metalazone. Furosemide, ascending limb of loop of Henle. Triametrin, renal epithelial sodium channel blocker. Mannitol, affecting the osmosis. So D, B, C, E. D, B, C, E. D, B, C, E. C answer will be there. Yes. Renin released from the juxtaglomerular cells of the kidney. In the kidney, there are two major cells. One is called as the J.G. cells, another one is called as the peritubular cells. And from peritubular cells, erythropoietin hormone releases, while from the J.G. cells, renin is released. Renin leads to the RAS system, while erythropoietin release from the peritubular cells leads to the formation of the RBC from the bone marrow. Acetazolamide, competitive. No, it's a non-competitive, reversible carbonic anhydrase inhibitor. Non-competitive, reversible. Actually, it's not irreversible. It's reversible and non-competitive. Non-competitive, reversible sulfonamide derivative, acetazolamide. Choose the correct pathway of the transmission of the impulse. SA node, AV node, bundle of his Purkinje fiber. Very important. Yes, it's an easy one, but the question can be there. Sir, furosemide also a thiazide diuretic? Not at all. Furosemide is a high ceiling diuretic. High ceiling diuretic, or we can say the loop diuretic. Read the following statement regarding the ACE inhibitor. ACE inhibitor are drug of choice for the management of CHF. Yes, we can say ACE inhibitor is the first line drug for the management of the CHF. ACE inhibitor are inhibiting the conversion of angiotensin 1 to 2. Perfect. Yes, it correct. ACE inhibitor are increased aldosterone production. No, it decreases aldosterone production. ACE inhibitor are increases in peripheral resistance. ACE inhibitors are increases aldosterone production. No, ACE inhibitor increases in peripheral resistance. Why? When there will be the no angiotensin 2 that not bind on the angiotensin receptor, then there will be the relaxation, not the vasoconstriction. So also it's incorrect. So you have PQ correct while RS is false, because angiotensin 2, this angiotensin 2 leads to the aldosterone production as well as there is lead to the peripheral resistance. But when you have inhibited the formation of angiotensin 2, so then how it can be correct? Yes. No, you are not. This one is correct. C is correct. Match the following drug and their classification. Propranolol, beta blocker. Okay, this antiarrhythmic drug classification. Find out. Question produce difficulty. Disopyramide, 1 class 1 sodium channel blocker. Dofetilide, Simadi, that means class 3rd. 𝘖𝙗𝘖, calcium channel blocker. So QSPR, anti-arrhythmic drug classification. Remember this word, very important. Number of time question asked from this anti-arrhythmic drug classification. Question produce difficulty. Medical lab pharmacist find more problem. Beta blocker, Simadi, 𝘖𝙗𝘖. Simple, very easy trick. Easily you can find out all the options. Read the following statement regarding the central sympatholytic. Clonidine is an imidazoline derivative having the complex action. Clonidine, yes, it's an imidazoline derivative. It's have various type of action. Type 2 diabetes mellitus is also known as the non-insulin dependent diabetes mellitus. Alpha methyl is noradrenaline, which is selective alpha 2 agonist. Alpha methyl is noradrenaline, which is a selective alpha 2 agonist. Wow. In the brain, alpha methyl norepinephrine or noradrenaline generated from methyl dopa act on the central alpha 2 receptor, decreases efferent sympathetic activity. Yes, as we all know that alpha methyl dopa, or we can say the methyl dopa, which is the alpha 2 agonist, which bind on the alpha 2 agonist present on the presynaptic nerve, or we can say the means so as an autoreceptor, and decreases the central sympathetic flow. So PQS is true and R is incorrect. That's why it's called as the central sympatholytic. Read the following statement regarding the dihydropyridines. Nifedipine is the first and the prototype drug of this class. Dihydropyridine, nifedipine, yes, it's a prototype drug. Nifedipine act rapidly due to which reflex sympathetic stimulation. Remember the word nifedipine, reflex tachycardia. Yes. Lecidipine is slowly vasoselective dihydropyridine suitable for twice daily administration. Nifedipine depresses SA node and AV node. When it causes the reflex tachycardia, then how it can depress the SA node? No, it's not true. Lecidipine is also vasoselective, is slowly vasoselective. Why? When it's dihydropyridine, then why it's act slow? Given once, incorrect. RS is incorrect. PQ is true. Lecidipine, highly vasoselective dihydropyridine suitable for once daily administration. Yes, it's a new one. But apart from this, you can easily find out all the things. At 11 p.m. you will get the biggest surprise. Get ready for that. Which of the following statement about clonidine is not true? Clonidine not true. Sudden withdrawal will lead to the rise in BP. Obviously, clonidine used for the hypertension. When sudden interruption will be there, then there will be the rise in blood pressure. Hypertension will be there. Plasma half-life 8 to 12 hours. It acts through the alpha 2A receptor in brainstem. It does not cause the postural hypotension. Yes, it causes the postural hypotension This one is not true. It causes postural hypotension. When it's stopped, postural hypotension will be there. The antihypertensive agent that should be avoided in young female and is used topically to treat the alopecia, minoxidil to alopecia. Yes, minoxidil used for the treatment of the alopecia. Treatment of choice in hypertension with diabetes mellitus. Treatment of choice in hypertension. So if hypertension will be there, so which drug you can easily given? Beta blocker never given. Thiazide can also lead to the hypovolemia, that diabetes mellitus can be contraindicated. Calcium channel blocker also not. ACE inhibitor, yes, yes. During the diabetes mellitus, you can freely use the ACE inhibitor because it causes the hyperkalemia, and hyperkalemia releases the insulin from the beta cells, so it will be the helpful situation. So ACE inhibitor we can use because ACE inhibitor sorry, ACE inhibitor used for the management of the hypertension and diabetes mellitus. There is one only possibility that ACE inhibitor hyperkalemia and hyperkalemia situation can lead to the increased insulin secretion. In plateau phase of cardiac arrhythmia, the movement of ions are plateau phase, depolarization, repolarization, plateau phase, repolarization. So actually what happened between this? So simply this is related with the calcium. So not one. Calcium moves out. So do you really think when the calcium moves out, then there will be the contraction can be happen there? Not at all. So calcium moves in, potassium moves out due to this repolarization phase. So yes, calcium move in and potassium moves out. Here one. Calcium influx while potassium begins to leave cells. Read the following statement regarding the thrombolytics. Thrombolytic lyses the clot or thrombi by activating the natural fibrinolytic system. What is the name of the thrombolytic? Thrombolytic, fibrinolytic. Have you heard about the fibrinolytic? Streptokinase, urokinase, 𝘿-PLase, rete-PLase. Yes, these break down the thrombi due to the formation of the inhibition of the plasmin formation. Okay. 𝘿-PLase are recombinant tissue plasminogen activator. Yes. Rete-PLase is a non-glycosylated detection of the plasminogen activator by recombinant DNA technology. Yes. 𝙂𝙋 is thrombolytic. No, it's an anti-thrombolytic, or we can say the anti-fibrinolytic. 𝜖-aminocaproic acid and tranexamic acid, this is not thrombolytic. So S is incorrect. Apart pre-QR is true. How all are correct? How? Is it true? 𝜖-aminocaproic acid is a thrombolytic agent. How you can justify that? Okay, next. Read the following statement regarding the plasma lipoproteins. Intermediate density lipoprotein are not detected in blood. Obviously, high density lipoprotein, also called as the good cholesterol, low density lipoprotein, bad cholesterol, very low density lipoprotein carry out the triglyceride from the intestine. Yes, all are true. Here all are true. No, it's true. Very low density lipoprotein. No. From the intestine. Sorry. From the intestine. This is the function of the chylomicron. Chylomicrons take the lipoprotein or the cholesterol from the intestine to the liver. So this one is incorrect. Sorry. This one is incorrect. So S is incorrect. Remember the one word VLDL, synthesized in liver, take the triglyceride from the liver to the all the body. Read the following statement regarding the HMG-CoA reductase inhibitor. Pravastatin is a newer statin, good cholesterol. Pravastatin is newer statin, good LDL cholesterol effect. Okay, yes one. Statins are the most effective agent for the treating hyperlipidemia. Statins have the maximum activity at the midnight, and all statins are administered at bedtime. Lovastatin and simvastatin are pro-drug. Lovastatin. All the statin class drug are pro-drug. Yes, it is. But one thing. Pravastatin, atorvastatin. Atorvastatin is the newer statin. Good LDL cholesterol effect. Pravastatin, not a newer statin. Else all the three are true. P is incorrect. P is incorrect. Yes. Why? Pravastatin introduced initially. Where is the pravastatin introduced? In the 1980, the class of compound most efficacious, most commonly used, best tolerated anti-hyperlipidemic or hypolipidemic drug. Pravastatin is hydrophilic and given in the active form. The LDL cholesterol lowering potential and efficacy is almost similar to the lovastatin. Yes, lovastatin, simvastatin are pro-drug. All are true, but first one, pravastatin is not a newer one. P is wrong. Yes. Which of the following factor converting prothrombin to thrombin? Good. Prothrombin to thrombin. Okay, give me the name of the clotting factor that is called as the labile factor. What are the name of the labile factor? Labile factor. How many clotting factor are there? How many clotting factors are there? Factor number 5. Factor number 5. Yes, total 13 clotting factor are there. Correct. But actually it's 12 because there is the no 6. How we can anyone say the 6? Okay. The 6 is not there. So total 12 is there. Remove the 6. But prothrombin to thrombin. Labile factor. 5 number labile factor cofactor involved in conversion of prothrombin to thrombin. Please remember all the name, all the clotting factor name. Very important and most probably to come in the any pharmacompetitive exam. Which among the following is an orally acting direct antithrombin inhibitor? Orally acting. These all are the direct thrombin inhibitor but parenterally, not orally. While dabigatran is orally acting direct thrombin inhibitor. What is the visible layer of the skin made up of? When you see the skin, this is made up of keratin protein. Fatty cells, muscles, melanin. No, it's a keratin protein. So, like griseofulvin that have the keratophilic property. It get deposited in the keratin protein. Hair, skin, nails. Yes. In the clotting factor pathway during intrinsic pathway, which one is correct? During intrinsic. During intrinsic. So intrinsic pathway actually start from the 12. Good. Firstly 12, then 11, then 10, 12, 11, 10 and 12, 11, 9 and 10 will be there. 12 here, 12, then we have the 11, then we have the 9, and after that we have 10. 12, 11, 9, 10. 12, 11, 9, 10. When intrinsic. While in the extrinsic, 7, 3, 7, 3, 10. 7, 3, 10. Extrinsic pathway. Sequencing. Mechanism of action of the gem fibrosine. When there is the fiber, always remember, yes, it's a PPAR gamma. Inhibit HMG-CoA reductase, inhibit HMG-CoA synthetase, decreasing plasma triglyceride level, or inhibit absorption. But remember, synthetase is not, reductase means statin, okay? And inhibit absorption of cholesterol, that is the voglibos, miglitol, no, 𝙭𝑒𝑡𝑖𝑣𝑖𝑟, okay, 𝙭𝑒𝑡𝑖𝑣𝑖𝑟. Decreasing plasma triglyceride level, that is the fibrosil, because yes, it activates the peroxisome proliferated activated receptor. Alpha will be there with the fiber, PPAR alpha, fibrate, PPAR alpha, decreases triglyceride, increases HDL, decreases LDL. Read the following statement regarding the prokinetic drug. Okay, these are the drugs which promote gastrointestinal transient and speed gastric emptying time, enhancing the coordinated propulsive motility. Okay, good one. Metoclopramide is actual prokinetic drug. Yes, metoclopramide and domperidone both are the prokinetic. Metoclopramide act through both dopaminergic and serotonergic. Metoclopramide is D2 agonist. No, it's a D2 antagonist. 5-HT3 antagonist, while 5-HT4 agonist. S is incorrect. PQR is correct. S is incorrect. Okay. Read the following statement regarding the proton pump inhibitor. Omeprazole. It is a prototype drug of this class. All PPI are administered subcutaneous route. Why? Why PPI can be administered by the subcutaneous route? Inhibition of hydrogen potassium ATPase by lansoprazole is partially reversible. Esomeprazole is the S enantiomer of the dexlansoprazole. I hope option are given for the previous one, because same mistake is there also. And the previous option was the same mistake. No, option are not matching. This one is correct. Q is incorrect, but there is no any other options. So we can say the PRS is true while Q is incorrect, then it can be okay. But actually, yes, H2 block PPI proton pump inhibitor, it inhibited the sodium potassium ATPase. Prototype member of this class is the benzimidazole derivative. All the omeprazole is the first line drug, or we can say the prototype drug of this class. It's a common use drug for the ulcer, for the Zollinger-Ellison syndrome, as well as the GERD. It's mainly causes the inhibition of the hydrogen potassium ATPase pump irreversibly. Only lansoprazole is there which can inhibit the hydrogen potassium ATPase pump by the reversible process. Safest proton pump inhibitor during the pregnancy, omeprazole and lansoprazole. These are the two drugs which can safely given during the pregnancy, because during the pregnancy the acidity problem is very common, and for that purpose this omeprazole is given. Outer covering of the testis. Sir, everywhere JDC is Firstly, we have the tunica vaginalis, then we have the tunica vasculosa, and then we have the tunica media. So outer covering is tunica vaginalis, outer one, then middle one, then inner one. So tunica vaginalis. Here is the covering, tunica albuginea, that is the innermost layer. Tunica vaginalis, beneath the tunica vaginalis, that is surrounding of the tissue. Tunica vasculosa consists of the network of the capillaries. Tunica media, that is the middle layer composed of, while tunica albuginea, that is the innermost layer is there. Why sucralfate should not be given with the antacid for the treatment of peptic ulcer? Because sucralfate need the acidic pH for their activation, but once we provide the antacid before sucralfate, then it can change the pH and increases the pH of the stomach. So there will be no any polymerization will be there and no effect of the sucralfate. So because it's polymerizes only in acidic medium, it polymerizes only in acidic medium. Correct answer is the A. Correct answer is the correct answer. Antiemetic effect of the metoclopramide is mainly due to the metoclopramide, that is the D2 antagonist. But D2 antagonist also, 5-HT3 antagonist also, 5-HT4 agonist also. Now the question is the mainly. How we can find out the mainly? So yes, D2 antagonist can be there because it comes under the neuroleptic class also. So we can say the D2 blocker. But once there is the question, tomorrow 21st May your admit card will be released. Okay, D2 antagonist will be there. It have the measure all three property, but as we can say all the drug it have the three property, but major one is the D2 receptor blocking property. Sulfa drug used in inflammatory bowel disease, that is called as the sulfasalazine, which is a pro drug which gets activated by the azo reduction in the two form called as the 5-amino-salicylic acid and sulfapyridine. 5-amino-salicylic acid uses in the ulcerative colitis. Sulfapyridine used in rheumatoid arthritis. So yes, sulfasalazine will be there. All of the following are hormones of the anterior pituitary gland except human growth hormone, anterior pituitary, no, prolactin, TSH, because antidiuretic hormone, that is hormone from the posterior pituitary, not from the anterior pituitary. The phases in which two identical copy of DNA are formed. Last year question. Two identical copy of DNA are formed, that is called as the S phase. But once if this question two identical copy of cell are formed, two identical copy of cell are formed, then there will be the answer will be changed. And at that situation, what will happen? That will be the M phase, mitosis. Here, S phase, DNA replication. Where DNA replication can be happen? So simply DNA replication mainly happen during the S phase, not in the M phase. Why does only female Anopheles mosquito causes malaria? Because female Anopheles mosquito only suck the blood and they spread the sporozoite to the host because it need the blood to nourish their egg. Female is evolutionary designed to be cruel. No, it's a blame only. Because female need blood from vertebral host to nourish the egg. Yes, it's a true. The derivative of sulfanilamide used to treat the ophthalmologic infection, sulfacetamide. C means visuality. That means yes, ophthalmologist uses sulfacetamide. Which of the following is true for the bone tissue? During the bone tissue development, actually what happened? Firstly, we have the osteogenic cell. From the osteogenic cell, then osteoblast, then osteocytes. Osteoclast, here is the two word. Osteoblast, formation of the blood cells. Osteoclast, cleavage of the blood cells. So here, osteoblast will be correct option. Osteogenic first, then osteoblast, then osteocytes, then osteoclast will be there. Osteogenic, osteoblast and osteocytes. This one is also the last year question. Mechanism of action of the quinolones. Quinolone, DNA gyrase inhibitor. We can say the quinolone as well as the fluoroquinolone. They have the same mechanism of action. DNA gyrase inhibition in gram-negative bacteria and topoisomerase 4 inhibition in the gram-positive bacteria. Which of the following act by the inhibition of the 30S ribosome? So simply by at 30 cell at 50 means aminoglycoside tetracycline at 30S ribosome and streptogramine, chloramphenicol, erythromycin, 𝘂𝙀𝙎𝙀𝙀𝙍 linezolid at 50S ribosome. So tetracycline bind at the 30S ribosome. If the question is there, which of the following drug can bind with the both 30S and 50S ribosome, then your answer will be the only aminoglycoside. Mechanism of action of tetracycline. Tetracycline bind to the A site and inhibit the attachment of tRNA. So tRNA cannot bring the new amino acid to the A site and there will be the no peptide bond formation. That's why it's called as the inhibit peptide chain elongation, not the translocation inhibition like macrolide, erythromycin, macrolide, 𝘂𝙀𝙎𝙀𝙀𝙍 linezolid carried out the translation inhibition or translocation inhibition, or we can say the post-translational modification can be inhibited by the macrolide. A macrolide antibiotic used as powerful immunosuppressive agent that is called as the tacrolimus. Yes, it's a macrolide antibiotic but also have the immunosuppression property also. Which statement is true about the griseofulvin? Griseofulvin, they are obtained from the Penicillium griseofulvum. They inhibit the thymidylate synthetase. No. They interfere with the mitosis. They are deposited in the keratin forming cell like skin, hair, nails. PRS true. PRS true. PRS true. PRS are true. D is correct answer because thymidylate synthetase inhibited by the 5-fluorouracil which activated in the presence of the cytosine deaminase and form the 5-fluorouracil from the 5-fluorocytosine. Then 5-fluorouracil converted into the 5-fluorodeoxyuridylic acid or 5-fluorodeoxyuridyl monophosphate that inhibit the thymidylate synthetase and inhibit the synthesis of the thymine. Given below are two statements. Okay, flucytosine is an antimetabolite type of antifungal drug which inhibit the thymidylate synthetase and decreases DTMP, lead to the inhibition of DNA synthesis. Yes, amphotericin B help to form the pore in the fungal cell and flucytosine can easily penetrate or permeate. Yes, both are true. Both are true. Obviously. And R is the correct reason for the A also. Which of the following bind to the viral envelope glycoprotein, preventing the conformational change required for the fusion of viral and cellular membrane? Which of the following bind to the viral envelope glycoprotein, prevent the conformational change required for the fusion? For the fusion, here FU, fusion, infoveritide, fusion. Okay, next. Salivary amylase help in digestion of which of the following nutrient? Amylase, obviously, starch. Amylase, starch. There are two types of amylase, salivary amylase and pancreatic amylase. Salivary amylase act mainly in the mouth cavity, while pancreatic amylase act in the intestinal region. The lytic enzyme released by the sperm. Sperm releases which lytic enzyme? Do it fast, finish it. Yes, hyaluronidase. There is only one enzyme present in release in the by the sperm, catalyzes the degradation of the hyaluronic acid. Choose the wrong combination of the drug and mechanism. Bleomycin, DNA fragmentation. Okay. Fludarabine, DNA polymerase inhibition. Pemetrexate, thymidylate synthetase enzyme inhibition. No, it's a dihydrofolate reductase enzyme inhibition. Mitomycin, bifunctional alkylating agent. You have to find out the wrong. So this one is the wrong. And the last question. It's all up to you. You have to answer all these. What is the correct answer? Inhibition tyrosine kinase. Imatinib, Gefitinib, Erlotinib, but not the Lapatinib, act by inhibiting tyrosine kinase through the EGF as well as the HER. EGF HER receptor. Gefitinib, Erlotinib, cetuximab is there. Yes. So these are the important question from the pharmacology, human anatomy and physiology, as well as pathophysiology. Okay. Sir, what is the surprise, sir? For the surprise, you have to wait 1 more hour. And in the GDC Bhokal, I will meet you all at 11 p.m. where I will reveal the today's best surprise. So, thank you so much to all. Here, I am going to stop this session. It was just only with the simple one-liner that you are never too late to fight for your goal. In the 4 or 5 days, what you have left in your hand, try to do your best. Try to just complete all your level best. What you can be the best, that is the good one. That after the exam, you don't have to regret. Okay, once I have to go with that, once I have to solve that question, once I have to go with that. So please focus for the next 4 days with full effort, full consistency, and yes, believe me, you are going to have a very good result in the final GPAT 2025 examination. So with this, all the best to all my dear students. Thank you so much to all. We will meet you in the next class. Thank you. Thank you everyone. All the best for your final exam. But for the next 4 days, keep revising and solve the question as much as you can. Thank you. Thank you everyone.